Hello everyone. So welcome back to Dental School where learning is simplified. Today I am here with one of the most important topics in the head and neck part of anatomy, that is the parotid gland. So let's get started. Hope you all know that there are three pairs of large salivary gland: the parotid, submandibular and sublingual. So in today's session we'll be talking in detail about the parotid gland. So the parotid gland is the largest salivary gland and it weighs about 15 grams. Now let's go to the location. The location of the parotid gland is in the parotid region. Okay, but where in the parotid region? We have to be very exact and precise about its location. So we can locate the gland mainly by three landmarks. The first one is it is below the external acoustic meatus and it is in between the ramus of the mandible and the sternocleidomastoid muscle. That is, anterior to the gland we have the ramus of the mandible and posterior to the gland we have the sternocleidomastoid muscle. Now I'll show you a picture so that you understand it better. This is the location of the parotid gland. So here is our gland. Okay, now this is the external acoustic meatus. So it is lying below the external acoustic meatus and anterior to the gland we have the ramus of the mandible and posterior to the gland we have the sternocleidomastoid muscle. So this shows the exact location of the parotid gland. Now let's move on. Let's see what is the capsule of the parotid gland. So the capsule of the parotid gland is formed by the investing layer of deep cervical fascia. So as you all know, there are 6 layers of deep cervical fascia, right? The first one is the investing layer, then we have a pretracheal layer, prevertebral layer, a carotid sheath, buccopharyngeal fascia and the pharyngobasilar fascia, right? That's just a background knowledge about the layers of deep cervical fascia. Here it is the first layer, that is the investing layer of deep cervical fascia that is forming the capsule of the parotid gland. And who supplies that investing layer of the deep cervical fascia? It is the great auricular nerve. Please keep this in mind as we will be coming across the same while we are doing the nerve supply. So it is the investing layer of deep cervical fascia that is forming the capsule. Now the fascia splits into two parts. It's splitting itself into a superficial lamina and into a deep lamina. Now let's see a little more about each of them. The superficial lamina is thick and adherent to the gland and it is extending all the way up to the zygomatic arch, whereas the deep lamina is thin. It is just the opposite as that of the superficial lamina. The superficial lamina was thick, whereas the deep lamina is thin, and it is attached to the styloid process, the angle and posterior border of the mandible and to the tympanic plate. So now the speciality about this deep lamina is that a portion of the deep lamina, it's just a portion, okay, a portion of the deep lamina that is extending between the styloid process and the mandible. Okay, a portion of the deep lamina that is extending between the styloid process and the mandible will become a little thick and it form what is called as the stylomandibular ligament. It's easy to remember, right? It's the part between the styloid and the mandible. So it is stylomandibular ligament. And what is its function? What does it do? It separates the parotid gland from the submandibular salivary gland. Now let me show you a picture. Okay. So here is this is the investing layer of deep cervical fascia. Okay, investing layer of deep cervical fascia. Now it's splitting itself to enclose the gland like this. There is a superficial part which is the thicker part. Okay, it is a thicker part, and then it is also forming a deep lamina which is the thinner part. So the superficial lamina the thick part is extending all the way up to the zygomatic arch, whereas the deep lamina is the thinner one and it is attaching itself to the styloid process, the tympanic plate and also the posterior border of the mandible. And that portion of the deep lamina between the styloid process and the mandible will become a little thick. Okay, see here you can see it a little thickened, and it is what is forming the stylomandibular ligament. And the stylomandibular ligament is what is separating your parotid gland from the submandibular salivary gland. Okay, so let's move on to the external features of the parotid gland. The gland actually resembles a three-sided pyramid. It's like a pyramid shape, but an inverted pyramid in such a way that its apex is point downwards and the base is the one that is facing upwards. Now the gland has 4 surfaces and 3 borders. Okay, now let's see each of them in detail. The 4 surfaces are, there is a superior surface, a superficial surface, anteromedial and a posteromedial surface. And now there are 3 borders, the anterior border, posterior border and the medial border. So the anterior border is separating the superficial from the anteromedial surface. The posterior border is separating the superficial surface from the posteromedial surface, and the medial border is separating the anteromedial surface from the posteromedial surface. Now it might look confusing now, but if you learn to draw this diagram, it's very easy. Now this is the parotid gland and this becomes the anteromedial surface, the anterior part, right? So this becomes the anteromedial surface. This portion becomes the anteromedial surface and this becomes the posteromedial surface. Okay, and this is the superficial surface. Now the border that is separating the superficial surface from the anteromedial surface is called as the anterior border. The border that is separating the posteromedial surface from the superficial surface is called as the posterior border, and the border that is separating the anteromedial surface from the posteromedial surface is the medial border, this portion. So if you remember this picture, it's very easy to remember the surfaces and the borders. So make sure that your concepts of the surface and borders are clear, because then only you can learn the relations. So once again I'm repeating, this is the anteromedial surface and this is the posteromedial surface. And here we have the superficial surface. Now let's move on to the relations of the gland. Now for each surface there are some certain relations. The first is the superficial surface. So the superficial surface relations are very simple. On the top you will have the skin, then you will have the superficial fascia, and then again deep you will have the parotid fascia, and then you will have the deep parotid lymph nodes. So these are the relations of the superficial surface. Now moving on to the anteromedial surface. The anteromedial surface, the relations are masseter muscle, the posterior border of the ramus of the mandible, the medial pterygoid, and we have the emerging branches of the facial nerve. Whereas the posteromedial surface, we have 2 processes, that is the mastoid process and the styloid process, and we have the external carotid artery. So let's see a picture. Okay, as I told you, this is the anteromedial surface and this is the posteromedial surface, right? So anteromedial surface, what are the relations? You have the masseter muscle. Okay, this is your masseter muscle. You have the mandible and you have the medial pterygoid. This is the medial pterygoid. And you have the facial nerve. This is the facial nerve. So 4 structures in relation to the anteromedial surface: facial nerve, masseter muscle, mandible, and the medial pterygoid muscle. You can remember it as maybe F, M, raised to 3 or something. Okay, it's like F, facial nerve, and then 3 structures with M: masseter muscle, mandible, medial pterygoid muscle. So that is the anteromedial surface relation. Now this is the posteromedial surface, right? So posteromedially, I told you there are two processes. One is the mastoid process and the other one is the styloid process. And you have an artery here. Okay, you have the external carotid artery also on the posteromedial surface. So with that, we have come to an end of the relations. Now we'll see what are the structures within the gland. Okay, so the structures within the gland, we have artery, we have vein, and we have a nerve. So let's see which is the artery. The artery is the external carotid artery. We just learned that the external carotid artery is in the posteromedial surface, right? As a relation in the posteromedial surface, we learned external carotid artery. It is the same artery that is entering the gland. You can see here, right? It is entering through the posteromedial surface and it's going all the way up and exiting itself through the anteromedial surface. It's entering through the posteromedial surface and it's exiting through the anteromedial surface. So that's what I have written here: entry through posteromedial and exit through the anteromedial surface. So one structure is the external carotid artery. The next one is the vein, and the vein is the retromandibular vein. And how is retromandibular vein formed? It's formed by the union of superficial temporal vein with your maxillary vein. And towards the end of the gland, or towards the lower part of the gland, the vein is dividing into an anterior division and a posterior division. Now let's see. This is the retromandibular vein. So as I told you, the retromandibular vein is formed by the union of superficial temporal vein. That is this one. Okay, superficial temporal vein and the maxillary vein here. So both the superficial temporal vein and the maxillary vein will form what is known as the retromandibular vein. Okay. Now the retromandibular vein is dividing itself into an anterior division and a posterior division. The anterior division is combined. This is the anterior division. Okay. The anterior division and the posterior division. Now the anterior division is combining itself with the facial vein. Okay. And it forms what is called as the common facial vein, and finally it drains itself into the internal jugular vein. Once again I'm repeating, the anterior division joins itself with the facial vein, forms the common facial vein, and then drains itself into the internal jugular vein. Whereas the posterior division of the retromandibular vein will join itself with the posterior auricular vein and drain into the external jugular vein. The posterior division of the retromandibular vein is joining with the posterior auricular vein and draining into external jugular vein. You can remember it as PE. Okay. Everybody knows what is a PPE now, right? So you can remember it as PPE. So that's it about the retromandibular vein. Now this is just a picture where the lower portion is just magnified a little. Once again, this is the retromandibular vein coming. Okay, that is formed by superficial temporal and maxillary vein. Okay, then retromandibular vein comes all the way down towards the lower part of the gland. It's dividing into an anterior division and then a posterior division. Anterior division combining with the facial vein and then forming a common facial vein and finally draining into internal jugular vein, whereas the posterior division is joining with the posterior auricular vein and draining itself into the external jugular vein. So this actually gives it a W-like appearance, right? It gives it a W-like appearance. Now moving on to the nerve. Now the nerve that is present within the gland is the facial nerve, okay? The facial nerve, and its entry is through the posteromedial surface and exit is through the anteromedial surface, same like your external carotid artery. Now there's something called as pes anserinus. I think you would have heard of this, or you would have seen this in some of your question papers. What is pes anserinus? So pes anserinus is nothing but a goose foot like appearance, And here the facial nerve is said to show a goose foot like appearance as it is emerging out of the parotid gland. Okay, it gives it a goose foot like appearance. See here, the facial nerve from the gland, it's passing through the gland, and in the anterior border of the gland it is giving off all its 5 branches. It's radiating onto the face, right? There's this temporal branch, then there's this zygomatic branch, then there's this upper buccal branch, the lower buccal branch, the marginal mandibular, and the cervical branch. So all of them are radiating onto the face, so it gives it like a goose foot like appearance, and that is what is called as pes anserinus. The upper buccal is actually passing above the parotid duct. Okay, this is the parotid duct here, and the upper buccal is passing above it, and the lower buccal is passing below it. Okay. Now coming to the blood supply. So far we have discussed about the structures that is passing through the gland, or the structures that are present within the gland. Now let's see what are supplying them. So the arterial supply of the parotid gland is through the same artery. It is the external carotid artery and its branches itself, the same artery that is passing through it. And the venous drainage is also done by the same vein that is present within the gland, that is the retromandibular vein, finally draining into the external jugular and the internal jugular vein. But coming to the nerve supply, it is not the facial nerve that is supplying the gland. Okay, the facial nerve is just passing through the gland without supplying any of its structures. The nerve supply of parotid gland is actually divided into 3. There is a parasympathetic, there is a sympathetic, and there is a sensory supply. The parasympathetic is very, very important. So let's see how the parasympathetic nerve supply starts. It all starts from the preganglionic fibers are all starting from the inferior salivatory nucleus. The inferior salivatory nucleus are present in your medulla. Okay. So from the inferior salivatory nucleus, the preganglionic fibers are carried by the glossopharyngeal nerve. The glossopharyngeal nerve is the 9th cranial nerve. Okay. So from the inferior salivatory nucleus, it is passed on to the glossopharyngeal nerve. Then from there, through the tympanic branch, then the tympanic plexus, then the lesser petrosal nerve, and the lesser petrosal nerve will finally relay into the otic ganglion. And from the otic ganglion, the postganglionic fibers are carried by your auriculotemporal nerve, and they finally supply the parotid gland. So for you to remember this, we have this mnemonic or a sentence, that is, it has lesser options anywhere. So I is for your inferior salivatory nucleus, and then there's a glossopharyngeal nerve. You have to remember that, the 9th cranial nerve. Okay, and then there is this T is for tympanic branch, and then the tympanic plexus, and then L is for the lesser petrosal nerve, O is for the otic ganglion, and A is for the auriculotemporal nerve, and finally it is supplying your parotid gland. So this is just the pictorial representation. I told you the inferior salivatory nucleus is in the medulla, right? So here it is, the inferior salivatory nucleus. From there, who carries? The glossopharyngeal nerve is coming all the way down, and then there is the tympanic branch, and then there's this tympanic plexus, and from there, lesser petrosal nerve will come and relay to the ganglion. And who is the ganglion? It is the otic ganglion. And from the otic ganglion, we have the auriculotemporal nerve carrying the postganglionic fibers and finally supplying the parotid gland. You can also remember parotid, right? So PAR is the parasympathetic. So the parasympathetic nerve supply is through the OTI, that is for the otic ganglion, so that you don't get confused with the ganglion. Okay. Now coming to the sympathetic nerve is derived from the plexus around the middle meningeal artery, and the sensory for the gland is taken from the auriculotemporal nerve, and for the fascia it is from the great auricular nerve. I think I mentioned this when we were explaining the capsule of the parotid gland, right? Okay. Now coming to the lymphatic drainage. The lymphatic drainage is done by the parotid nodes. that is draining themselves into the upper deep cervical lymph nodes. Now let's see a few lines about the parotid duct, as it can be asked as a separate short note or along with your essay. Now the parotid duct is also called as the Stenson's duct. Okay, please remember that it is also called as the Stenson's duct, and it's around 5 centimeters long. You can remember that as Stenson's is S, so S and 5 almost looks the same, right? So it's 5 centimeters long and it's emerging from the middle of the anterior border of the gland. And some of the structures in relation to this duct is, superior to the duct you have the accessory parotid gland, your transverse facial vessels, and you also have your upper buccal branch of the facial nerve. When we were explaining the pes anserinus, I showed you, right? The upper buccal is passing above the duct and the lower buccal branch is passing inferior to the duct. Inferior to the duct you have the lower buccal branch of the facial nerve. And the structures that this duct pierces, it pierces the buccal pad of fat, the buccopharyngeal fascia and the buccinator. All three are with the B, okay, with the alphabet B. Buccal pad of fat, buccopharyngeal fascia and the buccinator. Now coming to the applied anatomy, you can have inflammatory swelling of the parotid gland, which is very painful because of the unyielding nature of your capsule. You could have mumps, which is a viral infection of the parotid glands. You can have infections like parotid abscess, or you can even have mixed parotid tumors, which can be slow growing, benign and a painless tumor. And you could also have Frey syndrome. Frey syndrome is due to the damage of auriculotemporal nerve. Now, Frey syndrome itself is actually a separate topic of discussion. We'll discuss that later in a different video. Okay, so that's it. I think we have covered all the headings under the parotid gland. So just to summarize, we learned the location, we learned the parts and surfaces, the relations, the structures within the gland. We learned that there's external carotid artery, retromandibular vein and the facial nerve that is present within the gland. And we studied that the blood supply is by the same structures within the gland, that is external carotid and retromandibular, but the nerve supply is not by the facial nerve. Then we learned a few lines about the parotid duct, pes anserinus and also the applied anatomy. So now these are the few questions that has been asked in the previous years, and I think we have covered almost all of them. So I've taken the reference from B.D. Chaurasia's Human Anatomy for Dental Students and A.K. Datta Essentials of Human Anatomy. Now please get back to your textbooks and all the very best. Now if you found our video informative and helpful, please don't forget to like, share, comment and subscribe to our channel. And also, please press the bell icon so that you get notified whenever we upload a new video. Thank you.